Melanie Jackson here from MelanieTheMidwife.com, and this is a report on the research that looks at a systematic review called Routine Vaginal Examinations for Assessing Progress of Labour to Improve Outcomes for Women and Babies at Term. It's from the Cochrane database of systematic reviews, and it can actually be accessed freely online if you want to see the full report. Now, the Cochrane database of systematic reviews is considered one of the highest level sources of information in the clinical arena. And a systematic review is a piece of research, or it's a research method that's used to evaluate current research on an existing topic. So essentially, the researchers pull the relevant and available studies on the particular topic. So in this case, it's the use of routine vaginal exams, and they systematically review it to make conclusions based on all the pooled data. And in the research world, it's considered a complex undertaking, and this method of research is considered the gold standard. So in short, it's probably some of the most solid evidence you'll find. And now before we start, I'll explain the purpose and use of routine vaginal exams during labour. Now this review was looking at routine use of vaginal examinations to assess the progress of labour for women whose pregnancy was full term. Now, the use of vaginal exams means that, the use of routine vaginal exams means that they are done routinely on every woman who goes into that particular birth facility. And it's the way that it's performed is that it's a digital examination. So the practitioner uses 2 fingers with a sterile glove. And in many maternity settings, the vaginal examination is performed at the time that the woman arrives or is admitted to labour ward. Then again, to confirm that labour has actually started and is established. And once labour is what they call established, so women are usually past 4 or 5 centimetres, they continue those at regular intervals. And the formal timing of routine vaginal examinations varies between 2 and 4 hourly, although we know that midwives and care providers report that they under-record the number of vaginal exams they actually do. So it could even be more than 2 to 4 hourly. And in order to perform a vaginal examination, your care provider should first have your informed and full consent, although we know that this doesn't always happen. Then you'll be asked to lay on your back while the practitioner inserts 2 fingers into your vagina with the aim of reaching your cervix. And they do this to determine how wide open it is, how thick or thin it is, what the position of the baby is in terms of its head, where's its head lying or its bottom, and how far down in your vagina and pelvis has your baby descended. So in total, the procedure can take a minute or 2. And this research was saying that women are exposed to this every 2 to 4 hours. So what's the benefit? And if we have a look at what the research paper says and how it was done, we'll hopefully get some answers. So the authors included only randomized controlled studies, which is considered the big guy in terms of research methods, and medical people love a randomized control trial. Now, the authors could only find 2 studies that met their criteria to be included into the systematic review. One study involved just over 300 women, and the other one involved 150 women. And the first study compared vaginal examinations with rectal examinations, and the other compared 2 hourly with 4 hourly vaginal examinations. Now, given the lack of significant research that they found around the benefits of vaginal examinations, the authors concluded that we found no convincing evidence to support or reject the use of routine vaginal examinations in labour to improve outcomes for women and babies. The 2 studies included in the review were both small and carried out in high-income countries in the 1990s. So the research is old. And it's surprising there is such a widespread use of this intervention without good evidence of effectiveness, particularly considering the sensitivity of the procedure for women receiving it and the potential for adverse outcomes in some settings. So that was their conclusion. So what we know from this study is that in high-income countries, routine vaginal examination for the progress of labour is poorly researched, and we have no idea if it's beneficial or if it changes the outcomes for women and their babies. So The next thing that they were concerned about is adverse consequences. And they mentioned adverse consequences. So what could they be? In this paper, they say, if labours are slow but not abnormal, are misdiagnosed as being abnormal, this can lead to unnecessary interventions such as drugs to try and speed labour up, or caesarean section, or forceps for giving birth. And there are also concerns about introducing infection into the uterus by doing routine vaginal examinations. And in addition, some women find the process of vaginal examinations uncomfortable or distressing. So that was a short list of the disadvantages of vaginal exams. Now, they also state that the reliability is not high for the assessment of dilation of the cervix. So actually, when a midwife or doctor is doing a vaginal examination, are they actually able to accurately diagnose how wide open your cervix is? The authors say that actually no, that the use of cervical dilation using the practitioner's fingers doesn't appear to be a reliable way to measure dilation. And also that knowing the precise amount of cervical dilation doesn't appear to be a good predictor of how labour will progress or proceed. So basically, you know where you've gotten to, but it's got no predictive value. It can't tell you where you're going. Now, the authors comment that there is evidence that vaginal examination in itself may impact on labour progress in some women by raising their anxiety and interrupting their focus, and also by changing the amount of plasma prostaglandin, which as a result of stimulating the cervix. So there's a few physical things that actually happen during a vaginal exam that could actually impact on how quick labour will progress. Now, there is a lot more that could be said in this paper because it's actually full of a lot of information. But for now, what we know from this research is that there is a distinct lack of evidence for the benefit of routine or frequent use of vaginal examinations in labour, and that there are some risks associated with its use. So it looks like much more research is needed to determine if or how the intervention of vaginal examination can be applied in a helpful way to improve outcomes and experiences of women and babies during labour. And so this information is something that you could use to determine if you need a vaginal examination. And also for care providers, now you can offer women this information to help them decide if a vaginal examination would be of benefit to them. I'm Melanie the midwife, and if you found this helpful, pass it on.